My name is Tobias Leisenring. I was born in southeast Iowa, a little town called West Point. I now live in Flanders, South Dakota. I'm a maintenance manager at a local manufacturing facility. I woke up and I was in severe pain. And I had a kidney stone in the past, but this didn't feel anything like that. So because I thought it could be a kidney stone, I also thought maybe I had some kind of infection. I did not know. After having a really rough morning, and it was a very short morning at that point, I decided that I should probably come to the ER just to make sure that it wasn't anything more serious. Of course, I went right into the emergency department. I was greeted. I gave them my ID, and the only thing I remember after that is that I was immediately taken back to the triage area to be, triaged. So it was very quick, very, I don't want to say painless because I was in a lot of pain, but the administration process or the admin process was very good. So, they ran a CT scan, took a bunch of tests, urine, blood, and all that other stuff, and it was just, I don't want to say just a kidney stone, but it was a kidney stone. They were very good at saying, hey, everything's gonna be okay. They gave me some pain meds, of course, to bring that pain level down. And then, they were just in really good communication with me about what was going on in the entire process. There was no surprises with what was going on. Knowledgeable, friendly. They came in and said, hey, this is what we're doing. This is what it is, everything else checked out fine. This is how we're gonna treat it. And then this is what you need to do for follow-up. Drink lots of water, the pain medication, stuff like that. So I don't want to say painless, but it was quick. I feel that I passed the kidney stone before I went and seen the urologist. With the treatment that they gave me, or the medication that they gave me, of course, it's like adding heat to a hose. It loosens it up, makes it more flexible, which allows it to pass a lot easier. So, that was probably a big help for the passing of the stone. How quick it was. I mean, that when you're in that much pain, really you just want to get the care quick. You're spiking close to a 9 or 10. It'd be in about the worst pain you can have. When you're on the verge of passing out and it's making you physically ill, it's a high pain. I would say the only time that I've been in any more pain would have been when I broke my femur. So that gives you an indication. When you're in pain, it feels like an eternity, but in reality, they probably had pain medication in me within probably 10 minutes, I would say. It was really quick. I mean, really quick. Of course, if you feel it coming on, you don't want to be driving because it can cause you to pass out. And I've actually known people that have passed out due to them when they were driving. They were lucky enough not to get injured or into any kind of accident. I think the biggest thing is prevention. So I had a history of drinking sodas, and those are huge with kidney stones, along with other kind of like leaf drinks such as teas and stuff like that. So, you want to make sure that if you do drink sodas and stuff like that, that you do flush that out with plenty of water to make sure that those kind of things are not building up in your system. I would say that'd probably be the biggest thing is just, make sure if you're going to have those kind of diets like I like, make sure you flush that out with plenty of water. Their staff is friendly, knowledgeable. They take care of you. And I think that's probably the most important thing is that they're friendly and knowledgeable. I mean, you're already in enough pain or sick or whatever. You already got something going on. You don't need to be treated like a number. You need to be treated like a person. And I felt that they did.
Are you one of Brookings Health System's grateful patients who would like to give back to us? Learn more about how you can give back at brookingshealth.org/mythanks.